I am Miki Singh, Principal of Chinmaya Vidyalaya South Park, and I am going to conduct a session on awareness workshop on substance use disorder. So why is this topic relevant for this day? It's so because when our young people grow into healthy, happy and productive adults, India will emerge as a superpower in the world. As teachers, parents, and representatives of various institutions, we need to provide a healthy, growth-oriented environment for our young generation. Drug and alcohol use can cause havoc physically and mentally and destroy the young spirit. Presenting the right facts about alcohols and drugs and initiating life skill development will help our youngsters make informed decisions and stay away from substance use. So, the objective of today's program are to acquaint with the term substance use, increasing awareness to prevent substance abuse, strengthen capacity of the educators to address the substance use issues. Schools provide a rich environment to shape the attitudes and behaviors that help youngsters remain drug-free. Teachers have a great influence over school children and can present facts about alcohols and drugs and help students make informed and healthy choices. Teachers interact with the children on a regular basis and are in a unique position to present the right messages clearly and consistently. Teacher-led school-based prevention programs can help the students recognize negative consequences associated with alcohol and drug use, learn life skills which can help them build their positive qualities, handle difficult situations, and develop healthy problem-solving skills. It will help them to identify ways that they can have fun and enjoy life without substances. And they can learn ways in which to say no assertively to the people who ask them to start with substance abuse. Now, the thing is, what is substance? Substance is the term substance is used in reference to any drugs, medications, or toxins that share the potential for abuse. And what is meant by the word abuse? It is meant that misuse of anything is abuse. Going beyond the prescribed limit of anything is called abusing the substance. So today we are going to cover substance abuse and what is substance use. First, we will understand what is substance use. Substance use refers to the selected substances including alcohol, tobacco products, illicit drugs, inhalants that can be consumed, inhaled, injected, or otherwise absorbed into the body with possible dependence and other detrimental effects. Definition of substance use disorder. Substance use disorder, formerly known as drug addiction, is a medical condition that is defined by the inability to control the use of a particular substance or substances despite harmful consequences. In other words, SUD occurs when an individual compulsively misuses drugs or alcohols and continues abusing the substance despite knowing the negative impact it has on their life. People know that what they are using is going to impact them negatively. Still, they get addicted to that substance in such a manner that thinking of life without that substance becomes impossible for them. It is not only thinking, their body starts craving for that. So then comes a point in time when this usage becomes a disorder for them. So substance use disorder is a treatable mental disorder. It's not that there is no hope. There is hope. It is a treatable mental condition that affects a person's brain and behavior, leading to their inability to control the use of substances like legal or illegal drugs, alcohol, or medications. Types of substance use disorder. There are many substances that can be used, and there are a few which are mentioned in the slide, and we will take them one by one. Alcohol use disorder. This is very, very prevalent in India, along with tobacco use disorder. The next is cocaine use disorder, cannabis use disorder, tobacco use disorder, opioid use disorder, and it is common to have more than one substance use disorder at a time. Supposedly, a people may be addicted to both alcohol and cocaine and can be using both the substances at the same time. So in such a condition, if you are addicted to more than one substance, it is known as polysubstance use disorder. And alcohol use disorder is the most common type of substance use disorder in the entire world. There are many types of drugs, and alcohol is also a drug. Though the drugs may look different, all are mood-changing chemicals that change the way we think, feel, and behave. Drugs may be legal or illegal. Some drugs like cannabis, ganja are illegal drugs, and possession is punishable by law. Drugs which are prescribed by the doctors are legal. But again, the overuse of those drugs or going beyond what is prescribed limit of those drugs can cause harmful consequences. What are the symptoms? Can anybody give me the symptoms, how you can identify that the person is addicted or is under the substance use? Can you quickly type it in the chat box, your answers? What are the symptoms? Overeating, very good. Other responses? Red eyes, stay silent. Good. Some more. May I have some more of the responses? Over speaking. Red eyes. Red eyes. Okay. So depending on the substance that we are using, the symptoms may vary. So the symptoms depend basically on the substance that is there within our body at that point of time. And the symptoms can be categorically divided into two broad items, and those are intoxication. What is intoxication? When the substance enters our body, and as a result of the effect of that substance, we show symptoms like feeling sleepy, either we are excited or we are go into total calm mood or display intense emotions. People said overeating. And then we also make irrational judgment and decisions based on the substance that is there in our body. All such symptoms are covered broadly under the spectrum of intoxication. The other symptom which can follow are withdrawal symptoms. These are the symptoms that happen when the short-term effects of a substance wears off and the substance starts to leave your body. You may be आपने सुना होगा कि हैंगओवर हो गया था, सुबह उठ के बहुत ज्यादा सिर में दर्द हो रहा है. What is all this? These are all withdrawal symptoms. When the drug starts to leave the body, all these symptoms starts occurring in the body, and you feel nausea, you feel diarrhea, you feel muscle cramps and mood changes. So symptoms can be broadly be classified into intoxication and withdrawal. Swati. So according to the American Association and the DSM-5, the signs of substance use disorder include taking the substance in larger amount and for a longer amount of time than you are meant to take it if it's a prescription, having a strong desire or urge to use the substance, having unsuccessful efforts to cut down or manage the substance use, spending a lot of time obtaining or using the substance or recovering from its effects, having issues fulfilling responsibilities at work, school, or home due to substance use, continuing to use the substance even when it causes problems in relationships, giving up social, occupational, or recreational activities because of substance use, using substances again and again, even when it puts you in danger. And there are others which you can read along through the slide. Now, how does substance use disorder develop? Any idea how this disorder developed? Can I have any response, quick responses on the chat box, please? What do you think? How does this start and how does this disorder develop? Through counseling. How does this problem develop? Counseling can give ways to overcome this problem. Okay, Fine, we'll proceed with it. Studies found that many factors may be involved in the development of substance use disorder. These could include social pressure, curiosity of substance effects, performance enhancement, that is to do better at work or at school, and emotional escape, like relief from stress, anxiety, fear, or depression. So pressure from friends to use the decision to try alcohol or drugs may not be made by young person, but when others, that is his friends or relatives, encourage him, then at that point of time it becomes impossible for the young one to say a no to it, because he thinks that he might hurt the sentiments of the other individual who is persuading him to take these substances, to try these substances. Then in order to manage problem situations also, young people may try alcohol or drugs under the impression that it is going to help them deal with their sadness, disappointment, frustration, failures, anxiety, boredom, or fear. When a person takes a drug, it artificially forces the brain to release the feel-good chemicals that makes a person feel different. But the person has to be made like it is to be made clear to the young ones that this feel-good factor can be aroused in the brain through other things, like meeting your friends, doing a fitness exercise for 1 hour, or going out for a walk, maintaining a diary, listening to music, playing a sports. Lot of things are there where the person needs to discriminate that feeling good and feeling excited or motivated to do something can be triggered off in the brain by other useful and less unharmful activities. The progression to a substance use disorder follows this pattern. Experimental use, always we have seen that एक बार करके देखते हैं क्या होता है. So अगर एक बार किया and if you have that disposition towards addiction, तो एक बार ही काफी है आपके addiction को शुरू होने में. So we need to make the people and the students understand that no, they need to learn how to say no. And with every addiction, we have seen that trying the substance once, it starts with the first time, and the person has a choice to stay drug free. After the first use, it becomes difficult to resist it and becomes easier to use it again and again. Occasional use, after that experimental use comes the occasional use, that is taking the substance socially or using prescriptions not as directed. Then after your first use, then you think that in order to become more to socialize or to become more popular, let us do it on occasions together with friends and family. So then you fall into the trap of occasional use. After this state comes the state of heavy use. That is, you start taking those substances routinely. That is, every day, perpetually, without any day off, you are getting accustomed to taking those substances, which is actually a harmful situation, and you need to keep a check at this point. The fourth stage is the substance use disorder, when in a day, multiple times, without even thinking, you start taking these substances. There are really times when you are not using a substance. You are totally under the ill effects of substance use. And this is the time when we call it a substance use disorder, when you cannot think your life beyond the substances. Anything that you have valued for so many years, that treasured loved relationships, or anything that has been of good use to you, your academics, we need to make the students understand that everything goes for a toss when the situation comes to this. Drugs artificially, soon the amount of these natural feel-good chemicals in the brain become lesser. The person starts taking larger quantity to release these brain chemicals and feel good, but the desired effect is not as much as it was earlier. When the person is unable to get the pleasurable effect, the person increases the quantity or uses the drugs more frequently. The effect is not satisfying and not as good as earlier. However, the desire to take it again and again continues. Addiction gradually develops and the person feels sick, uncomfortable, or sad when the effects of the drugs wear off, or leading the person to take drugs in larger quantities and more often. Yet the person is unable to function well when the person tries to reduce or stop using. He or she is unable to take charge in that situation. Alcohol and drugs no longer give them the pleasure, but if reduced or stopped, withdrawal symptoms set in. The withdrawal symptoms may be physical such as tremors, body pain, vomiting sensation, and psychological in nature, making the person feel depressed, anxious, or irritable. The person now continues to use alcohol and drugs in order to reduce these negative effects. Alcohol or drugs are no longer fun to do, but the body has become so used to the presence of these substances, and the person feels unpleasant and uncomfortable with it or without it. Imagine the pain the person must be having. He is not finding happiness, or he is not finding that calm manner or composed, he's not in his composed state of mind, whether he is using the substance or he is not using the substance. He is left like he lands up in nowhere. Nobody can help him at that point of time. Stage of addiction. We will first discuss the stages of addiction. The first stage of addiction is initial use. Initial use, as we have discussed, is for the first timers, when we do it out of thrill or for the thrill of doing something new. Then comes the state of abuse. Abuse is the state at the point at which abuse occurs is defined based on the substance. The baseline of abuse is using more than what is needed, prescribed, or acceptable. Then comes the state of tolerance. Your body becomes tolerant and builds a kind of resistance, and you need more and more of the substance in order to get the thrill back to your life. And you feel like the more you take it, the more your body will become tolerant to the amount of substance that you have been consuming. Then comes the stage of dependence. Once the brain begins to realize that now it needs the substance to feel normal. So without the substance entering the body, the sense of normalcy is lost, and the brain gives the signals that in order to be normal, I need the substance. So resulting in physical effects also. Then comes the stage of addiction. The person can't think without, cannot think of about his life without any of these substances that he has been using. Supposedly, when we get up in the morning, those who are addicted to tea or coffee have that urge to have it. Otherwise, they complain of aaj chai nahi pi to sir mein dard ho raha hai, I cannot start my day, I'm feeling so lethargic. So what is this? This is a kind of craving that your body, the signal of craving that your body gives to your brain, that you need that particular thing you are accustomed to. So similarly, the craving is many times higher in degree when it comes to substance abuse. So think of the plight of the substance use, the people who are suffering from substance use disorder. And then is the phase of relapse, that is failing to stay sober. Never in a moment they can remain sober. They are always under the effects of those harmful drugs. Now this is the addiction cycle. Emotional pain is triggered. Then you start craving for relief. And where do you crave for relief? The craving for relief can be satisfied with either the preoccupation with any substance or by any behavior. Many times you must have seen a person behaving, repetitive behavior is happening in them. Why is this so? Unconsciously, he has become addicted to that behavior which he shows whenever he is under a stress or anxiety situation. So it can either be here I'm talking of both behavioral addiction and addiction of any substance. So substance use or compulsive behavior sets in. Short-term pain relief is there, but then the negative consequences resulting from behavior. Once you are under the use of that substance, then definitely your behavior goes haywire. And then when the withdrawal symptoms start setting in, you feel the guilt and shame of how the way you have behaved in public, and you start having a low self-esteem. Because of this, again, depression starts setting in the personality, and you again resort to self-sabotaging behavior, which again induces emotional pain, and the complete cycle goes on and on. Parts of the brain. Now in the current slide, we can see the different parts of the brain, and each part of the brain has its own specific functions. And these functions should be, the function of the brain is such that it is important for the overall smooth functioning of the body, because everything, right from problem solving to balance to coordination, everything depends on the smooth functioning of the brains. So each part of the brain is largely responsible for some activities, while other parts also may be involved. The picture shows the major areas of the brain that controls or handles specific activities. If you take a look, you can see how almost all the areas in the brain, that is coordination, vision, sensation, and movement, are so very well coordinated by the interplay of all the different lobes. And every time a youngster takes a drug or alcohol, then it interferes with the functioning of the brain. Of course, the person may feel normal after the effect goes away in a few hours. However, these short-term changes can also leave an impact, and the impact is quite strong. In the current slide, you all can see how serotonin, which affects regulation of mood and impulsivity, sleep, etc., gets affected by cocaine, antidepressants, stimulants, alcohol, and hallucinogens. Then endorphins and endogenous opioids affect the brain. Affected are heroin, opioids, morphine. You all can have a look at that, which lobe is getting affected because of which substance use. So we can also say that all drugs can have harmful effects on the physical health in a general way. While it may particularly harm particular organs in the body, lungs can be particularly affected with tobacco and cannabis. All drugs are broken down by the liver, but alcohol use particularly strains the liver. Though the drug by itself can harm the kidneys, most illegal drugs contain contaminants which also cause harm. For example, heroin may contain lead, pesticides, also other harmful chemicals. We can also see that they interplay with our psychological aspects of the brain, and we also develop psychological problems. Personality, they also hamper with our personality development. Cognitive skills also goes for a toss. So there are many ill uses, like these tamper with the smooth functioning of the brain by Now we should see the global statistics as released by the WHO on substance use disorder. 3.2 million deaths each year due to substance use disorder, which is the cause of which comprises of the 4.7% of all the deaths that take place in the world. 2.6 million deaths due to alcohol use disorder, and 0.6 million due to drugs. 2 million men die due to alcohol and 0.4 million due to drug use. And 400 million people globally have this alcohol use disorder, and 209 million live with alcohol dependence. Another statistics which has been released by UNODC is 292 million people consume drugs globally, and 64 million live with drug dependence. 9% of the drug users take treatment, and 5.5% female drug users take treatment. 14.28 male drug users take treatment. This is the statistics on substance use disorder in India. You can see the various substances which are mentioned in the table, and two age groups we have taken: children and adolescents, and adults, and the prevalence of these substance use among these two categories in percentage, and the estimated numbers of users. And we can see that alcohol use and inhalants also is quite high in India. Effects of substance use disorder. All of us know, apart from the physical impact that these substances have, there are other areas also which get impacted by these substance use. Can you all type a few responses quickly where you can put in what are the effects of these substances? be it alcohol, be it the drugs or the tobacco. कोई भी सब्सटेंस जो आप यूज करते हैं उसका क्या इफेक्ट्स हो सकता है आपके ऊपर? कैन आई गेट सम आंसर्स? टेम्परामेंट चेंजेस, वेरी गुड. Depression sets in, very good. May I have some more answers? Abusive words, person becomes unsocial, weakness sets in, behavioral changes can be seen. Stomach upset, okay. Anxiety sets in, very good. Thank you for all your responses. Now let us see the effects of substance use disorder, and it broadly affects at the individual level, at the family level, at the society level, economy wise also it affects us, and as nation also it has an impact on the nation. Now let us take the effects of substance use disorder on an individual. It affects the individual physically. It affects, in fact, all the organs of the individual. It causes insomnia, depression, anxiety, hallucination. Hallucination is when you start thinking about things which actually do not exist. You just think about them, and decline in the cognitive skill. As rightly, one of you had mentioned, that they are unable to think, they are unable to make judgment. So their cognitive skills also gets affected due to substance use. Legal, road accidents, jail, profession, lack of productivity, and loss of profession. If a person is unable to cope up with the situations, if he becomes asocial and he doesn't feel like his productivity goes for a toss, then definitely he or she will end up losing the job. Relationship also suffers. There will be a lot of fights in the family, with friends. So interpersonal relationship, even intrapersonal relationship will go for toss, because you are not able to think coherently. If you are not able to think coherently, how will you talk to your own self? How will you think about your own self? So intrapersonal relationship also goes for a toss. Then financial instability. If you lose a job, what will happen? Financially, you will not be stable. And again, you will need more and more money to be spent to procure those substances. Normally, in a family, nobody will readily give the money that, okay, you take this and go and get yourself those substances which are going to have a harmful effect on you. So, higher the cost of substance addiction. This again has its impacts, social impact, which we will discuss later. Now, what happens during adolescence? Why is this topic important to be brought to the notice for us as teachers? Because physical growth takes place and the body starts functioning like an adult. But at the psychological level, the growth is incomplete and the brain is still in the process of growing. Restrictions from others decreases and people start gaining independence. So alcohol and drugs along with youth become a risky mix. So it's a very lethal combination. Adolescence and use of alcohol or any such substance is a very, very deadly combination. It's a very risky combination. Different parts of the brains are responsible for different activities, and we have already gone through those slides. So it interferes with the normal functioning of the brain, which otherwise develops new connections, change structure, and improve functioning. Drug use destroys brain cells and cause lasting or irreversible damage to the brain. Irreversible damage which cannot be brought back. The things cannot be made healthy again. So we should make the students aware. Why? Because it is important for them to understand that they have to learn to say no. It also affects their academic performance. It reduces their motivation to do well. It causes difficulty with concentration, and it also affects their memory. Cognitive ability, that is the general mental capability, is affected, and the young person's ability related to comprehension, reasoning, planning, and problem solving reduces, which interferes with the academic performance of the students. So if you find anybody who has of late been not being doing academically well and is suffering from these things. You can try to explore into the reasons why all such things are happening. Could be one of the students amongst us is facing such challenges. So we should need to open up to them, talk to them, and show our concern that we are with them if they are going through such inner turmoils. Then it also impacts the mental well-being. Alcohol and drugs are used to feel better, but on the contrary, it affects the mental well-being and can increase anxiety and nervousness, cause depression, set off panic attacks, and may even trigger a psychiatric breakdown with delusions, believing that someone is plotting or controlling them. Every time they are thinking, they are suspicious of somebody's intentions towards them. They are never ever positive about anybody's intentions towards them. They always feel that somebody is plotting, scheming, or trying to control them, or hallucination, that is hearing, seeing, or feeling things which do not exist in reality. They also set off panic attack, inability to handle normal life, and sees drugs as the only way to cope up with pressures. They find ultimate solace in the usage of drugs or any other substance under which they feel very, very normal. It also impacts their physical health. It affects the sleeping and eating routine. Somebody had mentioned overeating. They might overeat or they might stop eating also. And they might feel like they undergo insomnia. It reduces their stamina and well-being. छोटे छोटे काम करने में वो थक जाते हैं. Affects particular organs and lead to respiratory and cardiac problem. This is true mostly for people who smoke or use alcohol. The young person is also unable. It also impacts the personality growth and induces problem behavior. The young person is unable to handle normal pressures of life as he or she sees drugs as the way of coping up with life. The young person starts using substances to handle the normal pressures that every young person faces. Everybody faces. They have to be made to understand that sabke life mein ye problems hai. It's nothing new which is happening to them. So they should not resort to such means. He or she may start using drugs to deal with anxiety, failure, frustration, irritation, boredom, and even happiness, and is unable to function as an emotionally stable and healthy person. Alcohol and drug changes the way one behaves and increases the likelihood of conflicts and disagreements with peers, teachers, and parents, attempting suicides, and becoming physically aggressive and violent, and injure oneself or destroy property. Young people may get into trouble with authorities and as a result face disciplinary problems at school and may be suspended or dismissed from the school. Many a times disciplinary problems at schools also occur. So might be they are under the influence of substances we need to explore, and then these may lead to their suspension, which is not at all good for a healthy development of a child. Safety and legal risks. Alcohol and drug use affects safety and increase the risk of falls, accidents due to poor judgment or poor coordination while driving or operating machinery under influence of drug, reduced inhibition and caution, increasing chances of sexual encounters. Risk to life. Due to an overdose or the presence of chemicals in a particular drug, even the person might die. So it also is very, very risky for the person's life. Indian drug law prescribes stern punishments for possessions and trafficking of drugs. Now, this was at the individual level. Let us explore the effects that substance use disorder has on the family. Can I have some quick responses in the chat box? How do you think it can impede with the family relations?
Disengagement.
Disengagement, very good. So they are poor communication. The person who is not in himself or herself, how will he try to communicate with the others? And the parents also, because of their helplessness, they see that nothing, like any kind of persuasion is not yielding any result. So they start withdrawing from the children, and therefore it leads to poor communication. The person who are addicted are always become habitual liars also. In order to get substances or to gain the trust of the family, they start speaking lies, and because of which they fall into the trap, and soon the family members lose their trust on such people. And because of this, even shame, guilt, and frustration occurs. The person knows deep down that what is happening is because of his behavior, because of his addiction. He tries to fight it out, but he's unable to do so. And as a result, he also feels the guilt. He also feels the frustration. The kind of happy life he led with his family does not exist anymore. So the feeling of shame is also there in them. It also attaches social stigma. बहुत बार सुना होगा हम लोगों ने कि छी कैसे है ये, इसको बदल नहीं पाते. बोलना बहुत आसान है, बट सोशल स्टिग्मा बहुत बड़ी चीज है जो किसी भी फैमिली को अच्छी नहीं लगती है. एंड बिकॉज ऑफ दिस सोशल स्टिग्मा ऑल्सो फैमिली दे स्टॉप socializing. They do not want to intermingle with the other people, but then they should try to understand that the more they try to reach out for help for their own children, that is a better way. And through talking and coming to know about these problems, they might come to know that other families also have the same kind of problem, and together they can come to a solution how to go further, how to seek help in such matters. Lack of physical or emotional safety. Marital conflicts are also a result of such substance use disorder, and codependence is also one of the effects of SUD. Denial mode. Aksar, we have seen many a times that these patients are under the denial mode. They are always denying that, okay, I am quite all right. I am doing fine in my life. Nothing is wrong. And they are always saying कि नहीं मुझे कुछ नहीं हुआ है. And they point blank, they refuse that they have taken any sorts of substance. The greatest loss is that they have missed out on all the positive aspects of being young and failed to use the opportunities for fun, learning, and growth. Now, the effects of SUD on society. Homelessness. Many a times the parents, they disown the children. They say कि अब तुम्हारा कोई काम नहीं है, तुम घर छोड़ के चले जाओ. So homelessness is one point, such point, and such homelessness will also really set in a lot of criminal behavior. Nobody will readily give money for these activities. So people try to snatch these, they resort to stealing, they resort to robbery, they resort to snatching things from passerbys, ongoers. So this is also one of the social problems which one faces because of substance use disorder. High risk sexual behavior is also one of the effects. Unemployment is also one of the effects. आपकी cognitive abilities रहेंगी नहीं. You are not being loyal to your own self. So how can you be loyal to your employer? So employment is also one of the unemployment is also one of the effects of substance use disorder faced by the society. High rates of suicide. The person ultimately out of depression resorts to means such as suicides, and we come to know that because of such and such reason, the person committed suicide. High imprisonment rates. Definitely when the criminal behavior is rising, the law comes into action and imprisonment rates also go up. Social discrimination. Because of that social stigma attached to such families, social discrimination also starts taking place. People start to discriminate with the people or with the families wherever there are members who are addicted to any of the substances. Effects on the nation. Healthcare costs go up. Think if with the increase in the number of people taking drugs or any other substance, the kind of expenditure that the government would have to incur for rehabilitation and bringing them again back to the mainstream line. So healthcare costs is one of the major concerns. Legal provisions, courts, prisons, police, statutory bodies have to be set up, and so many legal provisions require, again, whole lot of expenditure. Record keeping, unnecessary recording, so many data, keeping a record, tracking everything case to case, what are the statistics, everything becomes very, very cumbersome. Then economic loss, definitely the money which could have been used for other developments and other progressive tasks for the nation does not take place, because major chunk of the finances, major chunk of the budget is used into the rehabilitation and bringing them back to the mainstream. Certain myths versus fact. Let us explore what are the myths related to substance use disorder. Beer and wine are not harmful, but the facts are 330 ml of beer contains 145 ml of wine and 45 ml of alcohol. So who says that beer and wine are not harmful? There is no reason to wait till 21 to start drinking. This is the myth, but the fact is brain development happens till the age of 25. Underage drinking often leads to substance use disorder. Drinking will make me look cooler at parties. Don't you think people try to act macho and think that they will look cool? But it's a dumb way. You might puke. Probability of high risk behavior such as fights, drunken driving, etc. is higher when you drink. Drinking will make people like me. Instead, you may act foolish and say and do such things which will make you look like a fool. Instead of people liking you, people will start taking dislike towards you. Smoking is a good stress buster. Nicotine doesn't help in stress reduction. Painting or other hobbies will be more beneficial. I feel more confident when I have consumed narcotics. The actual is physical exercise and meditation will have a better effect on your confidence level. So there are other ways of feeling confident rather than going for such stupid ways. We have to make the students realize this. I speak confidently under the influence of narcotics. You need help for public speaking and opening up. You need not have narcotics or be under the spell of narcotics. Rather, you need to go in for public speaking classes. My friend told me it's macho to consume narcotics. There are other ways. Join Indian Army and show that you are a macho. Now the question is, how can we be of help to the students? Adolescence is a period of change. The transition from being a child to learning how to be an adult can be very, very challenging at times. There are many changes in the body that the child may not be comfortable with. The expectations from the family, school, and society may be at conflict with each other. The pressure to conform to the rules and perform well at school can be very, very high. This can be a time of great stress when the young person is not able to cope up. The body and brain is going through a lot of changes. So young people's brain is working in such a way that they are strong emotions, and yet the part of the brain involved in judgment and decision making has not yet fully developed. दिखने से तो बड़े दिख रहे हैं, but emotionally and psychologically they are not fully grown. So it is a very kind of turmoil is going inside them, which they are not able to cope up with. It is easy for young people to feel very strongly and make decisions based on emotions rather than facts. So we need to make them understand that your decisions should be fact-based and not emotion-based. And we will be focusing on helping, we should also help them understand that they need to deal with stressful situations step by step. The first thing in the list is that identify the problem. They have to identify what the actual problem is and describe the situation. Then they should think of all the things that can be done to overcome such a situation or to overcome the problem situation, and discuss at length. And this as teachers, we should make them this life skill of problem solving. We should instill in them. We should develop in them. And then we should discuss the consequences of each option and weigh the pros and cons of each option, and then come to a conclusion that which option would work the best. And we can also ask the students to maintain a thought diary, which is very, very discomforting for them. The thoughts which are discomforting for them, they should make a note of these thoughts in the diaries and then think about it, how they could have coped up with those stressful situations and what steps they could have taken. Then it is easy for young people to feel strongly and make decisions based on emotions. Then importance of saying no in dealing with offers to try substances should also be taught to the students. It has to be made clear to them that their decision should be very, very clear, and they should be very firm in saying a loud no with a confident posture. Simply state the decision of that no to the stranger or to the person who has been offering the substance in a straightforward and brief manner. And they should also suggest alternate activity. The students who have, if an individual has been suggested by his known person to try these drugs, they should also then tell them that there are other ways of coping with such situation instead of taking alcohol or drugs. And then lastly, if still they are being pestered by those people, they have to leave the place if the others repeat and offer many times in spite of saying no. It is very, very important for us to emphasize to the students that it is not difficult to say no to friends, and no can be said without insulting or hurting the others. Moreover, saying no may help others in the group to say so. Thus, they not only protect themselves, but others also stay drug-free. We have also to make them understand that at their age, it is natural to have strong reactions and responses, and it is okay to feel sad, angry, and jealous. It is important to deal with the feelings in the right way and to identify ways by which they can have fun and enjoy life without substances. We should make them understand the importance of holistic living, right amount of sleep, right kind of nutrition, good relationship with the close ones, hygiene, mental and personal both should be maintained, and activity also should be, they should be engaged in some fruitful activity, be it a professional activity or a physical activity. Now we will, although we have discussed it all, a quick glance at this slide tells us that at the individual level, there are the risk factors like poor impulse control, low harm avoidance, sensation seeking. So many are there. And what are the protective factors against the risk factors? We need to inculcate the mastery of academic skills. We should engage them in following rules for behavior at home, at school, and in public areas. They should be able to make friends and develop a good peer relationship. Let us now discuss the protective factors in case of family. We have seen that the parenting style also is one of the risk factors. Either the parents are very, very lenient, or the parent and child are always in conflict. Inadequate supervision and monitoring. There are times when both the parents are working and they do not have time to see what the child is doing. Too much of discipline, over disciplining the children, then not treating the children in appropriate manner, then substance use among the parents or siblings also. These are the risk factors. And what can be the protective factors? Consistent discipline, neither too tight nor too light. Just the right amount of discipline is important. Language based rather than physical discipline is there. You shouldn't become physical while you are disciplining. You should be only vocal. Language से ही, प्यार से ही उनको समझाना है, या कभी कभी जरूरत पड़े तो सख्ती से समझाएं, but do not become physical with your own children. Extended family support beyond the parents. We also have our grandparents, our uncles, aunts, so we can ask the parents to we can ask the students to talk to them if they feel not so comfortable talking to their parents. Then we have the school and peers. The risk factors at school are school failure, low commitment to school, peer rejection, deviant peer group, peer attitude towards drug. What are the protective factors? Healthy peer group interactions, school engagement. School should also take an active engagement in the well-being of the students, positive teacher expectation, effective classroom management. positive partnering between the school and the family, school policies and practices to reduce bullying, setting high academic standards. And now let us go through this video, which will give a quick recap on the session.
A glass of wine helps me relax.
My doctor prescribes these painkillers for me, so it's fine, I still take them.
Meth, it's taking everything from me.
I understand what rock bottom means. These are the voices of substance use disorders. They are young and old, rich and poor, from every ethnic group, religion, gender, and sexual orientation. And one of those voices is mine. I've learned a few things through this journey. One thing I know, addiction doesn't discriminate. Our crave for substances takes over our lives. We become dependent on them. We make dangerous decisions as a result. We lose the things that mean the most to us. I know because it happens to me. This is what medical providers are talking about when they say substance use disorder. It is called mild, moderate, or severe based upon the number of symptoms and problems you have. Every substance has its own diagnosis. So you might hear people say alcohol use disorder, tobacco use disorder, cocaine use disorder. Here are a few of the things that people say they experience.
1. They develop tolerance to the drug. This means if you used to feel tipsy with 2 glasses of wine, you start to need 3 to get the same effect, then 4. 2. They feel withdrawal when the substance leaves their bodies. Withdrawal is when you feel horrible, and the only way to feel better is to use again. 3. They take risks due to the substance. This could be driving under the influence or other dangerous behaviors. 4. They spend a lot of time thinking about the drug or figuring out a way to get it, take it, and recover from it. 5. They stop doing things that used to mean something to them. They miss work or school, and they withdraw from their friends and family, making excuses for missing events. They have problems with the people in their lives. 6. They take more of the drug than they wanted to. They might head to parties with the intention of having 2 drinks and driving people home, but they end up too drunk to drive, and sometimes driving anyway. 7. They crave the drug. This can feel physical or emotional. Craving is real, and it's painful. They want it to stop, and using helps the feeling go away. You know that feeling you have about the first cup of coffee in the morning? That's a craving. With other substances, that feeling can be much more intense. 8. Many times they want to cut down, but they just can't. Not without help.
If you've noticed any of these symptoms, you might have a substance use disorder. There is hope. Treatment works. There are many ways to treat a substance use disorder. Treatment can range from inpatient treatment to detox to 12-step support groups in your community. Talk to your medical provider. Living with a substance use disorder does not mean you are weak. Treatment works. People go on to live fulfilling lives. I know, I've done it.
So even if you have seen patients or people with substance use disorder, there is still hope for them. As school, as teachers, we can always identify if any of the students in our schools have these underlying symptoms, and they can be directed for treatments. And what we can only do is realize those symptoms and talk to the parents. We cannot do anything much beyond that, but at least recognizing and lending a patient ear to such students is also the first step in making them go for and making them ready to undergo a treatment. So these conditions are also treatable to a certain extent, and we are not the right people to we can just diagnose and we can just make out whether the student needs our help or not, and then we need to contact their parents, and then the parents can be advised to take them to the for their rehabilitations. Now, a small quiz based on the session that we have had. DASH refers to the physiological symptom that occurs upon discontinuation of a substance. What is the answer to it? Can I have the answer in the chat box? I know we are running short of time, but just 2 more minutes if we can have. The correct answer is withdrawal. Withdrawal refers to the physiological symptoms that occur upon discontinuation of a substance. A patient withdrawing from alcohol is at risk for seizure and hallucination. Is it true or false? I'm getting the responses a little late, but fine. True. Very good. The answer is true. Next. Caffeine is a stimulant present in coffee, tea, cold drinks, all of the above. What will be the answer to it? Caffeine is a stimulant present in coffee, tea, cold drinks, all. Okay, all. I have an enlightened audience today. All of the above. Then the fourth question is, a person is drug addict because of habit of drug taking, overpowered desire to take the drug and increase the dose, irritable behavior and emotional detachment, none of the above. I got the answer, overpowered desire to take the drug and increase the dose. Thank you for the correct answer. Which of the following is an example of addictive drug? Antiseptics, sedatives, antibiotics, and analgesics. This is quite easy. C, D, B. No. The correct answer is sedatives, which makes you feel calm. And this is one of the drugs prescribed by the doctors if the person is suffering from anxiety situations. And it is very, very easy to get addicted to the sedatives. Chalo, good. Next is, what next? We have to make the students realize that if you consume a substance or thought of consuming any substance, then you need to take a U-turn. And also, if they do not take a U-turn, they will be hitting a dead end. So, with this, we have come to the end of the session, and I would like to thank all of you for attending the session today. And definitely, as teachers, as educators, your message will influence many youngsters to make the right choices, and they will probably remember with gratitude your encouragement and support, your conviction that life can be happy and fun-filled without alcohol and drug. Hari Om and thank you. If there are any queries, I'm ready to take them up, or else I will wind up the session. Thank you all for your encouraging comments. I hope there are some takeaways from today's session, and you start developing a more compassionate look out towards your students and try to help them. Okay. If there are no more questions, then you may start leaving the session. a great day.